Idaho remains the state in the nation with the largest doctor shortage. And because of that, lawmakers are looking at ways that it can expand the number of medical seats funded by the state. Welcome to the news at 10. I'm Abby Wilt. Lawmakers met this week to brainstorm ideas. Aspen Shumpert joins us in studio now. Aspen, what all was discussed?
Abby, right. This group has been meeting since last summer. This is a group of lawmakers and other officials. They're now bringing forward ideas they hope can turn the state shortage around.
And we have to do better.
Idaho lawmakers are planning for the state's medical education future.
We're 50th per capita in how many physicians we have available to our population and providing health care.
Representative Dustin Manwaring, who's part of the state's undergraduate medical education plan working group, says the state is in crisis mode and it would need to add 1,400 doctors just to reach the national average.
We can have an Idaho-born student or an Idaho student that gets into a residency here, then we have a higher propensity that we're going to keep them.
The working group presented its ideas to the state's Joint Finance Appropriation Committee Thursday to help bridge the gap on the doctor shortage.
If we don't do something different than we've always done, we will continue to struggle and even go down further as we grow as a state.
Right now, the state funds 50 undergrad medical school seats, 40 through the regional WWAMI program, and 10 at the University of Utah. The committee wants to add 10 more undergraduate seats this year.
The cost here is approximately $350,000 to $485,000. It's $350,000 if we put all 10 at ICOM, if we purchase 10 seats at ICOM. If we split it 5 and 5 with University of Utah, it's a little bit more expensive down there. It would be $485,000.
Other plans include adding 15 graduate medical education seats and creating a health education director position to coordinate placements across the state. But some lawmakers, like Representative Kyle Harris, worry the state also needs to add more clinical sites.
If we keep bringing in more physicians to get trained and we don't have sites to put them, it's a wash.
And Representative Rod Furness says hospitals in his district, including Salmon, one of the most medically underserved areas in the country, tell him loan repayment programs are key to recruiting doctors.
And that's a real incentive for residents to go to those rural areas.
Manwaring didn't disagree with the ideas and says all of it is a step in the right direction.
We have now a sort of a roadmap or a guidebook or maybe a plan to start building, and we're just getting started.
While these are just recommendations right now, lawmakers will continue budget discussions throughout the session. Abby, as we know, Idaho is facing a $40 million budget deficit just this year, so we'll see where these proposals land.
All right. Thank you, Aspen.